think about it, all of us is smarter than any of us, and I really see that when we're working in AboutHealth, that we get to work with some of the top quality health systems in the whole state. And it's very open, it's very sharing, it's very important for us to progress using the AboutHealth model.
I think the biggest improvement was deciding on the evidence. We decided on the evidence on the first day. And as we move forward, I think the second best opportunity we had was the many check-ins with the various groups amongst the populations.
When we look at the metrics, the WCHQ metrics, we've moved from having 6 to 9 that we track over time. We've moved from having 3 of the 6 in our goal range to having all 9 of those in our goal range. We all have our challenges, but there's so much commonality in our challenges and what we're trying to do that it kind of builds that team effort. And then I take that back to ProHealth Care, to the medical group, and share that with our physician leaders, who then share it with all of our providers. And we have that strength of numbers and that strength of many, many people aiming at the same high goal of excellent diabetic care.
I think we're quite proud of our diabetes improvement. We've had significant improvement over the past 2 years since we started really concentrating on it. We've really looked at the process. We've used the recommendations and the algorithms that were set up by AboutHealth, and really have hardwired those into our workflows now in the clinics, again, making us much more efficient.
I think the scorecard that we get every month is just a way of visual management that puts our data right out there in front of everyone, from administration to providers to staff.
We refer to it as being with the best of the best. So it really makes you step up your game. It makes us better.
What I've enjoyed most about it is really the collaborative nature of all the organizations getting together and sharing best practice. What's working well for them, what's not working well for their organizations. And together we were able to develop a common care pathway for the care of diabetes.
Value is always to start with what is the best practice. Some of them can step forward and say, this is what I've done. We've been trying to do this for 5 years and we've learned this, this, and this, and now we're at this place, so that you can take some of those bits and pieces and kind of put it together, which actually speeds up a lot of the process improvement work and the efforts that we have. So AboutHealth is very beneficial.
I think improvements here at Gundersen are accelerated by the setting of goals for measurement. We all have a common goal of improving advanced care planning conversations and the quality of advanced care planning services, and to have sort of a friendly competition around this is a great idea.
As a direct result of this collaborative and the direction of our orthopedic provider, Dr. Grace, we've established post-op day 1 early mobilization protocols, and we're starting to see decreased in length of stay and increased discharges to home versus skilled nursing facilities for our patients.
We're looking at some data that was showing on average patients were staying around 21 days in the nursing home, and through the work in collaboration, we were able to work with these facilities and reduce that down to about 12, 13 days. We're better utilizing our resources, and I think are making improvements much quicker.
So one of the things that we faced is we were doing an awful lot of improvement work within ThedaCare. When it's just 1 or 2 surgeons and a few administrators, and they're trying to change things and go in a very different direction, it makes it difficult for us to execute it and actually sustain for the long term. By having AboutHealth and learning that we weren't off base, that we were heading in the right direction, it allowed us to accelerate, and it allowed us to have more confidence, especially for our surgeon champions, to know that we're not out there alone.
Our length of stay, although it's low, was still higher than some of the other AboutHealth collaborative groups. We decided to look at what anesthesia we're providing to our patients and how can we change that so that we're better able to mobilize our patients on day 0 rather than waiting until day 1. Since we've done this and we've worked with anesthesia to change the anesthesia we've provided, we have seen a significant decrease in our length of stay, and our patients are happier because they're leaving the hospital sooner. So I would say we were making improvements, but what AboutHealth did they have these monthly phone calls. And at first, to be honest, I really didn't want to do the phone calls because it was holding me accountable for the work and holding the team accountable. But now, when I really look back, I say every month when we have those phone calls, I am proud to be on that phone or have staff on the phone to say the work that we've done over the last 4 weeks and to compare that with the work that the other AboutHealth groups have done. And the phone calls are important because at every one of them we get more ideas on what we can do to improve.
The quality work that's gone on in AboutHealth has not only complemented but has accelerated. Interestingly, the set of recommendations that came out or the goals that were set in AboutHealth were almost verbatim the goals that we were working on. So, for example, when we went to our neurosurgeons to discuss with them, we had charted a new way to prepare patients and optimize them for better outcomes in the preoperative phase of surgery. And we needed our neurosurgeons to trust us in giving us the patients without scheduling surgery to allow us enough time to do our work. And I think when we went to them, they were very receptive, and part of that that had come from their participation in the AboutHealth Collaborative, because they were hearing the same things coming out of our mouth as they were hearing when they went to these collaboratives.
Let's say you have an issue with readmissions, or let's say you have an issue with ICU length of stay or ventilator length of ventilation, postoperative ventilation. These are the kind of things that we can discuss in an open forum and learn what other people are doing, good, bad, or otherwise. When you're able to be honest with other programs and say, hey, you know what, they're doing something different that works. Maybe we should investigate that. And this AboutHealth allows us to be quite honest with each other. I really like that.
I am very excited because although cardiac rehab has always been important to Aurora and cardiac care, we are taking it to a higher level. So we now have a cardiac rehab optimization group with 2 vice presidents, and we have a project manager.
I had the opportunity to go up to the AboutHealth in December to actually look at cardiac bundling and look at best practices for cardiac bypass surgery, acute MI, and for cardiac rehab. It was really nice to actually have physicians there that you could bounce things off of and have them really think about what they're doing in their practices, and whether it be in the clinic or within the hospital. So we had really good discussions.
For me, sitting in the cardiac surgical section, understanding where patients are at from as soon as they are discharged. Some of the practices are calling patients on a daily basis to see if they have questions. So we brought that back to the offices, and it is one of the things that they have implemented.
One of the things that I walked away with from the collaborative was cardiac rehab. I was so impressed with some of the rates of participation in cardiac rehab. And probably the one I really liked the most was as you're providing the education for an angioplasty procedure or for bypass surgery, that you present the whole cardiac rehab and the procedure as this is part of your treatment plan. It's the procedure and it's cardiac rehab, and presenting the whole package deal. And that's really what it is we want for the patient. I really like those strategies, and we're going to be adopting those.
So for the collaborative that we had in December in Wausau of this year, we had providers go to that, we had staff go to that, we had administrators go to that, and we all came back and within a week or 2 period of time really delineated a list of things that we thought that we could accomplish in our organization and set time frames to them. And so that was really very helpful for our program to be able to reach out to the other AboutHealth providers and to really see where they've had wins, and then allowing us to go back and look at, okay, we thought this piece was going to be challenging, but look, it was actually pretty easy, and Wausau was successful with it. everyone is engaged, and that I think is the nicest part of all of it. The two leaders for both cardiology and CT surgery were at the collaborative with us, and so really heard from the other organizations that this was a really important thing, to really having a multidisciplinary case review for patients so that we're treating the right patient at the right time with the right type of procedure and the right provider.
Being part of AboutHealth helped us. For example, I can think of a specific program, radial. We've been trying to move forward with radial caths, and we thought we were fairly ahead of the curve. However, when we compare ourselves within AboutHealth, we saw that we were ahead of a couple of systems, but well behind some other ones, and that surprised us. And gave us, I think that sharing that with my partners gave us all a new impetus, and we've met since that collaborative, all the cardiologists, the interventional cardiologists met, and we thought that, yeah, this is something we're going to bring forward and accelerate.
It expedites our process improvement efforts because somebody has already done the work and we don't have to reinvent the wheel. We can take best practices from the other AboutHealth members and utilize those.
Be able to bounce ideas off of other people is just so extremely valuable. You're given ideas you wouldn't have thought of before, and so networking is huge.
Here's my personal thought about the engagement at AboutHealth and our opportunity as leaders within ProHealthcare to participate. It has been an extreme gift.
Being part of something that spans most of Wisconsin gives our providers, our staff, the feeling that we're not just in it alone. We're part of a big movement in improving care in the state of Wisconsin. And AboutHealth is how we do it.